Welcome back, students. This week, our lesson is going to focus on miscellaneous punctuation. Last week, we talked about commas and the different rules as far as placement of commas. This week, we're going to talk about all the other punctuation. So are you ready? Let's get started. To help us start thinking about different punctuation, let's look at our Who Wants to be a Millionaire question this week. What mark of punctuation is used to separate hours and minutes in a time expression? Is it A, semicolon, B, colon, C, an apostrophe, or D, parentheses? B is the correct one. A colon separates hours and minutes in a time expression. The different punctuation marks that we will talk about this week include the period or the decimal point, the semicolon, the colon, hyphen, dash, an apostrophe, quotation marks, parentheses, and the diagonal. And of course, all of these rules are also explained in our textbook as well as the AHDI Book of Style. The objectives for the remainder of Chapter 3 include knowing the names of the different marks of punctuation as well as the different rules for using each mark. So similar to the comma rules that we learned last week, we'll learn the same types of things for the remainder of our miscellaneous punctuation this week. So are you ready? Let's get going. Let's start by looking at the period and the decimal point. In dictation, you will hear dictators either say period or full stop, they'll also use that word, or decimal point. We're going to use those words as appropriate, such as, smallpox has virtually been eradicated from the face of the earth, period. Normal body temperature is 98.6 degrees Fahrenheit. Notice how in that number expression we use the word point, meaning a decimal point. In recent years, we've also had another name come up for this type of punctuation, such as you may obtain information about AHDI at www.ahdionline.org. So the period and decimal point also has a new name called dot. We use that as appropriate specifically for our websites. So we're going to use a period or a decimal point at the end of a declarative sentence, and this is something that we've learned a long time ago. After a complete statement and a complete thought, we're going to end it with a period. We'll also use a period at the end of a request for action that's phrased as a question out of politeness. So, will you please make an appointment for follow-up tests? In that situation, the doctor is not asking you if you want to make an appointment. They're basically telling you, make an appointment for follow-up tests. But they're being polite about it, so it's phrased as a question. But we do not put a question mark here. We're going to use a period. Versus, will you be able to work on Saturday morning? That really is a question, yes or no. Are you going to work on Saturday morning? So do you see the difference? For a request for action that's phrased as a question out of politeness, we're going to use a period. We're also going to use periods with lowercase Latin abbreviations, such as AM and PM. And notice when we use lowercase AM or PM, we're going to have periods in between. We also have a lot of Latin abbreviations used with our medical language, and specifically when we're talking about medication dosages, such as PO and TID. That's how those are dictated. PO meaning by mouth, TID means 3 times a day. But notice how those are separated out with periods. P period, O period, and lowercase t period, I period, D period. And that is how the AHDI Book of Style recommends them to be done. That's the preferred method there. We're also going to use a period with the name of genus when it's abbreviated and used with the species. And a genus and species is just a classification of living organisms divided into families. And so a very common one that we hear a lot is E. coli. And we would type that as capital E period space C-O-L-I, coli. And it means Escherichia coli. Escherichia is the main genus name, but we shorten it with the capital E. And if we do just use the abbreviation, we're going to put a period after it. We have a list of information about genus and species on page 188 of the Book of Style. Also, in the back of our textbook, take a minute right now and take a look at this reference information on genus and species names. And this would be an excellent addition to your reference binder, your information station after we're done with our class here this semester. I would really recommend carrying that out and putting that in your information stations for reference in the future on genus and species names. Many times they're rather cumbersome and big names, such as M. pneumonia, meaning Mycoplasma pneumoniae. So things like that, they're big names and sometimes hard to remember, so it's a great reference to have. Take a look at them right now in the back of your textbook. We use periods or decimal points in outlines, such as listed here, and note that our word processing packages such as Microsoft Word automatically put in our periods as needed in the outlines. Our next few slides will clarify when not to use a period or a decimal point. The first reason not to use a period or decimal point would be with metric and English units of measurement, such as milligrams, abbreviated as mg, milliliters, liter, centimeters, word per minute. Note, however, 4 pounds, 2 ounces, we do spell out pounds and ounces with statistical information and English measure. We'll learn this down the road, but just so you know, we don't abbreviate pounds and ounces in this situation. So again, don't use periods or decimal points in between our letters when we're using metric and English units of measure. The preferred method with certifications and licenses, as well as academic degrees, is to no longer use periods to separate them, such as CMT for Certified Medical Transcriptionist, RN, Registered Nurse, MD for Medical Doctor, DDS, PhD. You may have been taught in the past something like M period, D period, and unless you're working for an organization that's very, very traditional, we have dropped those periods in between the academic degrees now. So you may see this different in your organization when you get your job, but for the most part, and for what our Book of Style suggests, we're going to drop the period use. This slide illustrates a fairly new style change that we've had. In fact, the last edition of our textbook didn't have this as a rule of when not to use a period or a decimal point. So here's one that we're going to add. With initials and abbreviations with names, we're no longer going to use the period, such as Mr., MR, no period anymore, Mrs., MRS, Ms., MS. So no periods after those, and I know for those of us who have learned traditional punctuation, this is going to be a hard one for us to understand, but our language is always changing, and we're always getting style changes, and this is one that's illustrated in our book right now. The next one, Miss Diana Ross, M-I-S-S. Just a side note, if you don't know if a woman is married or not, always just put M-S for Ms. because you don't know. So that's always the safe route. Dr. Paula Carter, again, DR. We no longer put a period there. And again, another little side note here, we would never type something that says Dr. Paula Carter, MD. Doctor and MD are pretty redundant. It means the same thing. So we're either going to put DR before their name or MD after it as the title. So that would be up to your employer as far as what they prefer. We also do not use periods with acronyms. And just to review what an acronym is a word formed by the initial letters of several other words, such as AIDS for Acquired Immune Deficiency Syndrome. So no periods with our acronyms. Also, for most of our abbreviations that are in all capital letters, we do not use periods, such as CBC for Complete Blood Count, DNC. And notice in that situation how it is transcribed here, all together, no spaces, and no periods either. When we have capital letters and lowercase letters together with scientific abbreviations, no periods. RX for treatment, DX for diagnosis, RH is a type of a blood type, an RH factor, pH, and there's many others. And notice, no periods. Many times when healthcare providers dictate, they use what we call brief forms or clutch words, such as exam for examination or phenobarb for phenobarbital. Flu is the brief form for influenza. Sed rate is a brief form for sedimentation rate. Lab for laboratory. And look at pap smear here if we had to say that every time. So there are lots and lots of these words. Consult for consultation. EOs for eosinophils. Basals for basophils. We've got all sorts of these clipped words or brief forms. Some of them can stay the way that they are dictated, such as exam is fine. We don't have to always expand that out to examination. But notice that there are several of these what we call medical slang or these brief forms that need to be spelled out, and we will talk about those in a few weeks here. But what we need to know right now is that if we have a brief form or a clipped word, no period or decimal point used with them. While we're on the subject of medical slang, let's take a look at this Who Wants to Be a Millionaire question. Do you know? What is a hot appy? A hot appy. Think about that. What do you think that might be? Or how about a hot dog headache? Have you ever heard of that? Take a minute and think about that. A hot appy is acute appendicitis, and that's medical slang for it. And providers might dictate the patient came to the emergency room with a hot appy, meaning acute appendicitis. And in that case, we would definitely want to change that from hot appy to acute appendicitis. Hot dog headache is just a headache that, usually a migraine type of headache, that a patient may get from processed meats. People can get migraines from processed meats, so that's what a hot dog headache is. Again, medical slang that we would want to change to the right terms for us and for clarification. And let's look at the next slide here for reference about medical slang. In the classroom at Truex, we actually do have a reference called Current Med Talk, and it lists all sorts of medical slang, such as hot dog headache or hot appy. These are all listed in this reference as well as many, many others. So just realize there are references out there. If you find yourself on the job and hearing a lot of medical slang and you need a reference, you can find books on medical slang. In addition, our textbook also includes in the back of it a nice listing of short forms, brief forms, and medical slang that's found in the back of your textbook. Take a second here, stop our recording, and take a look at it. It shows the brief forms or the medical slang, and the nice thing about this too is that it shows with an asterisk if it absolutely has to be spelled out in full. So take a look at that, and remember that's a great addition to your information stations, those binders that you should all be starting to make. At the end of our course, I would suggest going through the back of your book and the appendixes and go ahead and tearing out these great references in the back of your book and add it to your information stations. As a side note, remember, if you're going to do that, if you're going to take out the reference information, please do not sell your book as a used book, because that's not very fair for the person who buys it after you. I've just seen that happen to students in the past, and it's very unfortunate. So just remember that. We're going to use a decimal point to separate a decimal fraction from a whole number, such as his temperature on admission was 99.8 degrees Fahrenheit, 99.8. The wound measured 2.5 by 3.5 centimeters. And that's how that would be dictated. And when we hear the word point, it means a decimal point. So we would put 2.5 space lowercase x space 3.5 space cm. The wound measured 2.5 by 3.5 centimeters. Notice that lowercase x takes place of the word by in that situation, and we'll learn more of those types of phonetic words down the road. You didn't think there was so much to know about periods and decimal points, did you? Well, let's move on to the semicolon. And the semicolon is a mark of separation, often equivalent of a period. So let's take a look at some rules for using semicolons. We're going to use a semicolon to separate independent clauses closely related when there is no conjunction. So let's just review real quick from last week. Remember our conjunctions? Remember our fanboys? What does that stand for? Do you remember? For and nor, but, or, yet, so. And remember, again, to review, an independent clause is a clause with both a subject and a verb. It can express a complete thought. It can stand alone as a sentence. It does not depend on any other words or phrases for the meaning. So that's just a review there. So we're going to use a semicolon to separate independent clauses closely related when there is no conjunction. Let's take a look at an example of this. And here's our first example of using a semicolon. Keep reading. The second part is related. Notice that those two clauses are closely related. They're independent clauses, closely related, that do not use a conjunction. One of our fanboys isn't in that sentence. So we're going to separate it with a semicolon. Keep reading, semicolon. The second part is related. Let's look at the next one. The patient is hemorrhaging, semicolon. Immediate care is urgent. And we could put a period there, and it wouldn't necessarily be wrong. However, these are so closely related that the semicolon is the preferred right there. Send your check today, semicolon. Your order will be shipped tomorrow. Again, two independent clauses closely related. We do not have a fanboy. We don't have this conjunction. We're going to use a semicolon. So notice that those examples do not have any internal punctuation or conjunctions. Let's look at our next example of when we use semicolons. We're going to use a semicolon to separate independent clauses if either or both already have two or more commas. So let's look at our example here. Around the 1st of July, comma, he developed pain in his chest, which he ignored for several days, semicolon. And, comma, finally, comma, he saw me, comma, at the request of his family doctor, comma, on July 16th. Not a great sentence, and we may want to redo this if we would actually get a sentence like this. But for the purpose of example here, with all those commas going on, we want to separate our two independent clauses more, and so that's why we would put that semicolon there, because we have all these extra commas. If this sentence was redone without all the internal punctuation, then we would not need a semicolon, such as, he developed pain in his chest, which he ignored for several days, comma, and he saw me on July 16th. So I hope you can see the difference there. The first example has all sorts of internal commas in our independent clauses, and the second one that I just said does not. So if we do have all those internal commas, use a semicolon to separate the two independent clauses. When we have two independent clauses that are joined with a parenthetical expression, we're going to use a semicolon before the parenthetical expression and a comma after it. So this is kind of similar to our comma rule with our independent clauses. The difference here is that it's not one of our fanboys. It's not a conjunction. It's what we call a parenthetical expression. And if you remember back to last week, our most common parenthetical expressions, for example, are therefore, however, consequently. So if we have an independent clause with one of these parenthetical expressions that links another independent clause, we're going to use a semicolon before it, comma after it. So let's look at the last line here. Her heart rate is slightly irregular, semicolon. However, comma, the patient is in no danger. So let's do the test. We have two independent clauses. Our first independent clause, her heart rate is slightly irregular. Put a period there. We could be done with that sentence. The patient is in no danger. Another complete independent clause. We would not need any other words for that to make sense, so that can stand alone as another independent clause. Now we have this word however that links the two of these independent clauses. Is however one of our fanboys? No, it's not. So it's not a conjunction. So we need a stronger part of punctuation there. We need a semicolon before however, and notice then a comma after it. Here's another example of that. After attempting to induce labor with Pitocin, comma, contractions occurred, semicolon. However, comma, the patient failed to develop an effective labor pattern, comma, and a discharge for after 8 hours. It's got a lot going on in this, and we could make this two sentences. After attempting to induce labor with Pitocin, contractions occurred. However, the patient failed to develop an effective labor pattern, period. I discharged her after 8 weeks. Or we could even do it after attempting to induce labor with Pitocin, contractions occurred, period. However, comma, the patient failed to develop an effective labor pattern, comma, and I discharged her after 8 weeks. We have a lot of options here, but notice where the semicolon is before that parenthetical expression, however, comma after it. And again, you are the editor, so if you want to change this into two sentences, you could, because this is kind of a long sentence if you have this dictated. And again, just listing the most common parenthetical expressions, however, furthermore, therefore, consequently, nevertheless, accordingly. Again, these are not one of our fanboys, so it requires, if it's linking two independent clauses together, it requires a semicolon before it and a comma after it. We're going to use semicolons with a series of phrases or clauses if the series has internal commas. So here's our example. The meeting was attended by Dr. Frank Byron, comma, Chief of Staff, semicolon, Mrs. Joanne Armuth, comma, Hospital Administrator, semicolon, Ms. Nancy Speets, comma, Medical Records Technician, semicolon, and Ms. Rhonda Johnson, comma, Supervisor, comma, Medical Transcription Services. So can you see there how the semicolons really let us know where one person and their title ends and the next one begins? So it's a good separation there when we have internal commas to help clarify that. Looking at that example again, look at how it all gets messed up here, and we just don't know where one person and their title begins and one ends if we just use commas. Go ahead and read that on your own and notice how important it is to have those semicolons to show and clarify where one ends and where one begins. Moving right along, let's take a look at the colon, our next mark of punctuation. So the colon is a mark of punctuation to draw your attention to an important list, example, or concluding part. And it makes you want to anticipate what's coming after the colon. Let's take a look at some examples. So we'll use a colon to introduce a list preceded by a complete sentence. And oftentimes this list is introduced by the words as follows, such as, namely, the following. So here's an example. The 5 most commonly prescribed drugs at our clinic are as follows, colon, Advil, Augmentin, Cipro, Coumadin, and amoxicillin. So notice that we have this word as follows, gives us this anticipation of what is the list coming up. We use a colon after introductory word or words in preparing a history and physical, when we're transcribing a history and physical, specifically when we're looking at patients' vital signs or introducing an outline, such as chief complaint, colon, nausea, period, past history, colon, usual childhood diseases, period, vital signs, colon, temperature, colon, 101, period, pulse, colon, 58, period, BP, 130/90, period, respirations, colon, 18, period. A couple things to notice here. We do use 2 spaces after a colon, and notice how each one of those items are closed with a period. Temperature, 101 degrees, period, pulse, 58, period. So when you start to do your transcription, in your transcription classes, start to transcribe at the end of each one of these sentences, we're going to put a period. Even though it's not a complete sentence, this is just another place where we're going to use periods. And again, notice the colons where we are going to use that. If you want to take a look at some sample reports, I would suggest going to the Book of Style. In the back of the Book of Style, we do have several sample reports there that will help show you the different formats. And those are the formats that we use here at Madison College as far as formatting documents. We also have some examples in chapters 12 and 13 of our textbook. They're kind of more older traditional styles, and more we're moving towards these samples such as in the Book of Style. So take a look at those. We use colon to introduce an example or clarify an idea. The overriding goal of transcription, colon, accuracy. If errors are detected, only one course of action exists, colon, correct them. The procedure to report a fire emergency is quite clear, colon, first dial 911 and then evacuate the clinic. So you can see here it's just to introduce an example or clarify an idea, use a colon. A few other uses of colons in salutations of letters, if we're using traditional mixed punctuation, Dear Dr. Jones, colon. Notice that we don't use a comma, we use a colon in salutations. Dear Dr. Jones, colon. To whom it may concern, colon. In clock time, we use a colon to separate the hours and the minutes, which was our Who Wants to Be a Millionaire question at the beginning of this presentation. Notice that military time, we do not use colons at all. And also notice if we do not have minutes, we do not use a colon 00. So for example, 10:30 a.m., we do 10:30, A period, M period. If it's just an even clock hour, such as 10 a.m., no colon 00. And we'll learn more about that when we're in our numbers unit, but just to give you a little preview there. Other uses of the colons include ratios and dilute solutions, such as mix the liquids 2 to 1, 2:1. The solution was diluted 1 to 50, 1:50. The odds are 5 to 1, 5:1. And look at the reference lines here. References, subjects, anything like that, such as subject, colon, lab results. Reference or regarding, any of those, we're going to put a colon after it. At this point, I'm going to pause in our presentation, and I'm going to make a new presentation for the remainder of the punctuation marks, just because I like to keep the files somewhat smaller and give you a chance to take a breather if you want to pick it up at another time. So I will see you back in a little bit to take a look at the rest of our miscellaneous punctuation marks.